Hi, this is Jonathan Marks, and I'm here today with Mark Stein, PhD. He's the director of the ADHD and Related Disorders program at Seattle Children's Hospital. He's also professor of psychiatry and behavioral sciences and pediatrics at the University of Washington. Dr. Stein is the incoming president for 2016 of apsard, the American Professional Society of ADHD and Related Disorders, which is having their 7th annual meeting this coming January 15th to 17th, 2016 at the Mandarin Oriental Hotel in Washington, D.C. He's part of a panel discussing ADHD and related conditions. His talk is entitled ADHD More or Less, Boundaries with Other Syndromes. Mark, can you share a summary of what you'll be speaking about?
Sure. When we think about ADHD, we used to think of a typical 7-year-old boy who's hyperactive and inattentive. But over the years, we've changed the diagnostic criteria, and more people are being diagnosed. The effect of that, both on clinical practice and on science, is quite significant. There's increasing recognition that the symptoms of ADHD overlap with other syndromes, some of which are related and some of which it's unclear how they're related. So we're very excited about this symposium that's going to address some of those issues related to barriers with other syndromes. So Dr. Burnett is going to talk about sluggish cognitive tempo. Dr. Pliska is going to talk about disruptive mood dysregulation. Dr. Mostovsky is going to review the motor system in ADHD. And Dr. Mahone is going to talk about neuro-psychological phenotypes. So we're going to get into different syndromes, how we define ADHD. Do we need more than the 18 behavioral symptoms listed in DSM-5? And as we get into the motor system, neuropsychology, and actually the construct of ADHD itself, this should be a very interesting and provocative symposium.
I want to refer to the point you made about more people being diagnosed. There's kind of a lore out there that people are being way overdiagnosed with ADHD. Is this true?
I think that ADHD is sometimes overdiagnosed. It's more often underdiagnosed, and it's very frequently undertreated. But I think there is confusion about the boundaries for what's ADHD and what's not, especially when we start talking about these other syndromes, like sluggish cognitive tempo, like motor coordination problems or developmental coordination disorder.
So this is going to be a very interesting panel that Dr. Stein is leading again at the upcoming meeting of the American Professional Society of ADHD and Related Disorders. Their 7th annual meeting is this coming January 15th to 17th, 2016 at the Mandarin Oriental Hotel in Washington, D.C. Make sure you're there to get all the details. Thanks for being with us today, Mark.
Thank you, Jonathan.